has already been tested.
Yeah.
So we want to bring in Dr. Frank Esper. He's an infectious disease specialist with University Hospital's Case Medical Center. Dr. Esper, thank you so much for being with us. Also, Dr. William Schaffner, chairman of the Department of Preventative Medicine at Vanderbilt University. But Dr. Esper, I do want to start with you. Do you see the spread of this as a realistic possibility, or we know that containment is a big part of being able to control this disease? Have they been able, do you think, to contain this in Dallas?
Yeah, the answer is I think we've always expected that there may be another individual who will come down with the Ebola from the transmission of this one particular person, and we always felt that it was going to likely be one of his close contacts or one of the healthcare workers, because that's the way this virus works. It's usually a disease that is spread to close family members or to the people who care for that individual. I will tell you that the fact that we identified this individual so quickly is actually, to me, a sign that the system is working, that we are able to contain it, because we knew who this person was. We knew that he was a person that we know all the people who have been taking care of Mr. Duncan, who had the Ebola disease. So we knew exactly who to keep a very good eye on, when to test, how quickly to isolate this individual so that we prevent the spread.
We've been requesting questions, any concerns from our viewers who obviously have some, using the hashtag Ebola Q&A. And Dr. Schaffner, I want to bring you one here from Pat Humphrey. And she asks, can a person spread Ebola from the moment they develop fever? Is fever considered the symptom? Of course, we know the answer to the latter, that yes, fever is considered a symptom. But from that first moment of the fever, of any symptom, are they now contagious?
Yes, Victor and Pat, they are contagious from that moment, and fever is indeed an early sign. But at the very earliest stages, they're not as contagious as later in the illness. So it's not like an on-off switch. It's a gradual process. So at the very earliest stages, it's still not so easy to recover the Ebola virus from the patient. But as the illness develops, the Ebola virus spreads further throughout the body and progressively makes it easier to be transmitted to healthcare workers and family members who might be caring for that patient in circumstances before the diagnosis is made.
Dr. Esper, I wanted to ask you about these experimental treatments that have been used in success, it seems, with a lot of people who have been infected. Mm-hmm. How readily available are those experimental treatments, and are they something that you would give to every Ebola patient?
The answer is, unfortunately, because they're experimental treatments, they are not readily available. The quantity that we have for many of these medications or anti-sera is pretty small, and because they're experimental, a lot of times we don't even know exactly how much we're supposed to be giving. A lot of times we may give too much of the antibodies, which will then further deplete the supply that we have. What I would tell you, though, is that every individual who does come down with this disease is given a whole range of options, and the range of options include experimental treatment. It is not required that a patient receives experimental treatment if the patient does not want to receive experimental treatment. The standard of care is supportive care. The immune system can defeat this virus on its own. However, we believe that these medications kind of tip the balance and may help the patient's immune system overcome this virus even more than the patient's immune system can do by itself.
Again, we are requesting the questions online, Ebola Q&A, hashtag Ebola Q&A. We got an update from the CDC. Their news conference will happen at 11 a.m. this morning. First, we're going to hear in about 20 minutes from now, the Texas Health Resources spokesperson tells us they're going to hold a news conference at 8:30, CDC at 11. Dr. Schaffner, you said something the last time we spoke with you about your confidence in hospitals across the country and their response. I'm going to press you on that, because in a county with as many resources as Dallas County and a hospital system as large as this, and they had as many problems and challenges as they had, when you go to a smaller county with fewer resources, is it Is it impossible to see how they would have greater challenges, thinking that they wouldn't have as many resources? I guess it comes down to education and having the stuff.
Well, Victor, I think awareness and education are key. Early diagnosis is key. Obviously, those smaller hospitals, if they made the diagnosis, would wish, as with other illnesses that are very, very serious, to transfer the patient to an institution with more elaborate resources. But as Dr. Espner said, the critical aspect of the care of these patients is supportive care. This is the sort of thing that our hospitalists, that is, the doctors who work in intensive care units, do every day for patients with a whole variety of illnesses. So the supportive care, that can be provided. Now, in addition, of course, we have to make sure that everyone who provides that care does so safely using rigorous infection control precautions.
All right. Dr. Esper, we appreciate so much Dr. Frank Esper, your expertise today, and Dr. William Schaffner as well. We'll be talking to you throughout the morning, but thank you for taking the time for us today.
And, of course, we'll have much more on the breaking Ebola developments. So we're also covering the ISIS advance in Syria and in Iraq. President Obama's defense chief is speaking out safety in the Iraqi capital. We'll talk about that.
And stick with us. We're gathering more information